Live. Y ya estamos. Hello, Planet Earth. Welcome to our live stream. Thank you for joining us. I'm Lilia Facial Team, offering this platform to give a voice to your concerns. My pronouns are she and hers. And please let us know today if you have any questions pertinent to rhinoplasties and facial feminization in the chat below. And we will try to respond to them as quickly as possible. Today's special guest is a maxillofacial surgeon of Facial Team who is an expert in nose feminization and will be talking to us about rhinoplasties in FFS. Welcome, Dr. Villinga.
Hi, welcome. Good morning, Lilia. Well, good afternoon or good evening to everyone.
Depending where you are.
That's it. Good.
Good morning for us.
Good morning there. Yeah.
So how has your week gone so far, Dr. Villinga?
Well, actually, quite busy. Let's say this is a very busy week. Okay, so let's say this last Monday we were doing 2 feminization rhinoplasties. Yesterday I did another two more, and today there is 2 more surgeries to be done. So let's say it's quite busy. Yeah.
Very busy, and today too.
Yeah.
So from what I understand, Dr. Villinga, you are an ordinary surgeon and have quite a history. Could you tell us a little bit about your background?
Well, my specialization is oral and maxillofacial surgery, which means basically we did a training of 5 years after 6 years of the degree of medicine. Okay. And then later on, I did 1 more year of kind of the specialization in facial cosmetic surgery in Belgium, in Brussels.
Right. And did you mention Mexico also? I know.
Well, yes, I didn't mention that, but yes, I did some kind of training as well in Mexico and also in Dallas in the States.
So how exactly does being an oral and maxillofacial surgeon help you in your work as a rhinoplasty specialist?
Well, that's a very interesting, very nice question. Basically, with this background as an oral and maxillofacial surgeon, let's say we, as these kind of surgeons, we understand quite good basically the facial anatomy, facial structure, but not only from a cosmetic point of view, as well as from a functional point of view, which is also extremely important when we talk about the nose.
Right, okay. That's very interesting. And what exactly is your role at Facial Team?
Well, officially, let's say I am the facial plastic surgery director, but mainly I deal with all rhinoplasties we do, but also some kind of, let's say, more cosmetic related procedures, like, for example, upper eyelid surgery or lip lift, fat transfers, otoplasty, and so on. But let's say 95% of my work is basically feminization rhinoplasty.
Of course. For those who don't know, what is an otoplasty?
Otoplasty is the surgery of the ears, just to modify the size or also the shape of the ears, basically to pin them back,
right,
closer to the skull.
And blepharoplasty is the eyelids, right?
Eyelid surgery, yes.
Under eyelid.
Basically, it's just rejuvenation and beautification procedures.
Okay.
It always works quite well, I have to say as well.
So what is your favorite part of working with Facial Team?
To be honest, being in the theater. I mean, operating. That's what I enjoy the most. Basically as well, I enjoy a lot, not also talking to a patient, but basically I enjoy a lot performing and planning my surgeries before undergoing or before going to the theater, to the operation theater. I enjoy a lot doing my plannings, or looking at the pictures, the CT scan. It sounds quite freaky, I know, but I enjoy a lot that.
No, I think it's good to be freaky in what your work is.
Well, you know me very well. I'm quite freaky in, let's say, more dimensions.
Geeky. No, we want surgeons
as well. Yeah.
To be geeks in their work. It's always a good thing. Attention to detail is what it's all about. So it's been
Exactly.
9 years.
Yeah,
Nine.
9 years, almost 9 years actually. Because I joined the facial team in in the beginning of 2013 or the end of 12. I think it was in the beginning, January
Okay.
2013. So it's long ago. Yeah.
Yeah. So now let's get to the questions because I know you're
All right.
busy and and
Perfect.
and,
Yeah.
and they're gonna call you to the operating theater very soon, so we don't want to miss out on any of the questions.
Anyway, take your time.
No. So you're the co-writer of scientific research on nose feminization.
Yeah.
Can you tell us a little bit about what the conclusions of these studies were?
Well, basically, I've been working, or I've already published 2 articles with the facial team group, talking about facial feminization surgery, but specifically talking about feminization rhinoplasty. And well, actually, we are also working on a new article, maybe to be published this coming year. Okay, I'm not sure. And the main conclusions are, of course, rhinoplasty in combination as well with the forehead surgery is one of the, let's say, the queen of the procedures when we talk about facial feminization surgery. And we should then take it into account as a kind of isolated procedure, okay? It's extremely important to take all the rest of the features into account. So it means it has no sense to go just for a rhinoplasty or just feminization rhinoplasty if we do not take care about the forehead surgery or basically the expression of the eyes of that person. So it means basically we have to search for good proportions in the face. And that's the main goal. And that's the key area when we talk about this specific topic.
Balancing the facial features. Right.
That's
so I've shared a link.
Harmony,
yes. Exactly. So in our chat here, I've just shared a link to a blog which has all the information that we're talking about today. And it also has a video where Dr. Berlinga is talking about a scientific publication on rhinoplasty. If anybody wants to have a look, check that link on our blog. So how many rhinoplasties, feminization rhinoplasties have you done?
Let me check because I have it here in my computer. I'm very,
I can tell you.
And here, until yesterday, it's 1,176 feminization rhinoplasties.
Okay.
Plus 2 more today.
Wow. Almost up to, wow. That's a lot.
That's a number, I mean.
Yeah. And along the course of these 1,170 something rhinoplasties, do you feel that you all are always seeing new challenges? Always. Because we say every face is different.
And that's it. And it's not it's very well known that once we go to the theater, it's every patient and every procedure is a totally different challenge. It's not all the same. That's what I try to say. So, of course, after every surgery, after every rhinoplasty, I'm still learning, okay? And of course, I'm still learning up. So I didn't reach yet my plateau, let's say, as a surgeon. So we try to evolve, and I try to keep on undergoing this evolution and try to be better and better and better.
Now, after 9 years, the whole being a surgeon has a very long curve, steep learning curve, no? Yeah. So, there's always something new to learn, and so let's get technical now, because as technology is always evolving, so you need to grow with that. That's why when people say continuing education or professional development, surgeons cannot just be stagnant. They have to keep up with the changing technology. So can you tell us a little bit more about the advantages that piezo surgery offers in the rhinoplasty? Because I understand you were the first or one of the first surgeons to employ rhinoplasties, employ PSO, which is
So,
ultrasonic
okay,
technology in rhinoplasties.
that's it. So piezo surgery or ultrasonic instrumentation, it's just basically a tool. And I have been using piezo since it was 2015, the end of 2015. I guess I'm not the first one, but I'm one of the first performing rhinoplasty using the piezo surgery. And as I told you, it's a very interesting tool, but basically because we can obtain or we can achieve a much more accurate and precise bony work. You know, most of the nose is true that is soft tissue. Basically, we are talking or we are dealing with cartilage, with skin, subcutaneous tissue. But when we deal with the bone, the old-fashioned techniques were about using a hammer, chisel, manual saws. And nowadays, with these tools, we can provide an extremely nice and precise sculpturing of the bone. So it makes everything much more predictable, under control, and it's always safer for the patients because there is always less swelling, less bruises, because there is less bleeding. It's much more respectful with the soft tissues. So as I told you, it's not a need, it's a tool, but it's an extremely helpful tool.
And another technology that you've started to use in rhinoplasties is 3D planning with guides. So like templates. Can you tell us a little bit more about that?
Right. Well, before undergoing any facial feminization procedure or surgery, we always go for a 3D CT scan, the skull, the whole face, just basically to check everything in detail. As I told you before, once we go to the theater, we must have a very strict and rigid plan. So it's not about, you know, going crazy or messing around once we are in the theater. Everything has to be under control and very predictable, very precise. I like to compare ourselves as robots. Sometimes it's like, okay, plane, this is step 1, 2, 3, 4, 5. We do not even speak when we are in the theater. It's because everything is very protocolized. That's what I try to say. With this technology, with the 3D CT scan, we can check very precisely the anatomy of the nose in this case, like in the surface, but also in the inner portion, in the inner part. So I have to check the turbinates, I have to check the septal cartilage, but also I have been using the 3D printing. I mean, from the images from the CT scan, we transfer them to a 3D printer. And with that 3D printer, using a software, a very specific software, I can design some kind of cutting guides or templates that will be used during the surgery. And using them, I can very precisely make the cuts and the osteotomies for the nasal narrowing, for, you know, making it straighter when we have a crooked nose. So I can make everything much more precise, following, you know, the original planning and following, you know, the studies I have been doing using the CT scan in our patients. So everything becomes much more predictable and safer and easier for us as surgeons as well.
I think that this is just amazing, how the 3D technology combined with the ultrasonic tools is able to
helps a lot. It makes my life easier, let's say. As I told you at the beginning as well, this is not a need, but it helps a lot. And of course, this transfers to our patients. I mean, it's all these technologies provides a better result for our patient, and of course, a better recovery as well. So that makes everything always easier, as I told you, not
absolutely
not for me, but also for the patients.
For both parts, because of course there are always risks of complications, which we'll get to a little bit later in any surgery, and whatever we can do to reduce those risks is welcome for both parties. So can you tell us a little bit more about what a dorsal preservation rhinoplasty is?
Good. Well, it's nowadays when we talk about rhinoplasty, not only feminization rhinoplasty, but rhinoplasty in general, it's a kind of new trending topic, talking about techniques. This type of technique, which is named dorsal preservation, became very popular in back to the 2016, more or less, with a quite powerful, strong scientific publication. And it is basically about getting rid of the hump or reducing the hump of the bridge of the nose here without or respecting the junction in between the bony part and the rest of the bridge of the nose, which is made of cartilage. So it's a non-destructive, let's say, technique, because we preserve totally the highest portion of the bridge of the nose. And we basically, what we do is we push it down, actually. So we keep the roof intact, let's say, but we eliminate the hump. I know it's a bit complicated, it's a bit difficult to explain, but it's just basically, reshaping the nose, removing the hump without damaging the bridge of the nose. Let's say it's a bit complicated, I know.
Thank you for that explanation. And that actually brings me to another question that's not in our list of questions. Something that I've seen people ask is rhinoplasty with forehead feminization. If you're not sure about having a rhinoplasty, what would be your recommendation? Having the rhinoplasty before, after FFS, if they had to do it separately?
All right. It's a very interesting question. When I have a consultation with a patient, I always like to say surgery is not a need. And this is a truth. And surgery should be taken just as a boost of confidence for you and just for you. So it means if you have doubts, you're not sure about doing or not doing something, the best idea you can have, or my best advice I can give you, is don't do it. Okay? It's true that, as I told you, we are not talking about a cancer, appendicitis, or trauma. We are talking about elective surgery, actually. Okay? The other things like hormones, facial hair removal, logotherapy or speech therapy, the way you dress, the way you move, and the way you act, that's, as I like to say, 99% of all transitioning. Surgery should be taken, as I told you, as a boost of confidence. So it's not a need. It's like a very small piece in this big puzzle of transitioning. So going back to this question, actually, there is no wrong answer there. You can go for a rhinoplasty simultaneously. You can go before or you can go after the forehead surgery. But the most important thing, if you have doubts or you're not sure, then don't do it. Or do it first, the forehead, which is the queen of the procedures, the one that is going to feminize you the most in most of cases. And then reevaluate yourself in the future. Maybe 1 year or 2 years later, you can look at yourself in a mirror and say, you know what? Okay, maybe I would like to go for a rhinoplasty, or nothing, keep it like that. I mean, there is no wrong answer talking about that.
Okay, thank you for that. I just wanted to comment, when you referred to elective surgery, a lot of patients would say that facial feminization procedures, including the rhinoplasty, shouldn't be considered elective. In fact, in Spain, facial feminization is recognized as a functional necessary surgery and no taxes are applied. But in the case of rhinoplasty, do we still have to consider that at a, say, legal administrative level as an elective surgery, or is that included?
Yeah, because it's all about society. Here still nowadays, most of people consider rhinoplasty as kind of cosmetic procedure, or just simply a cosmetic procedure. But when we are talking just specifically about feminization, of course, it has a very important role when we talk about, achieving the most feminine version of that person. So
exactly.
That's it. Here in Spain, it's true that there is no taxes. I mean, and when we talk about this type of procedures, of course, if there is a cis women or a cis man undergoing a rhinoplasty, that's basically for cosmetic purposes. And of course, then those taxes are applied. But this is not the case, because we are talking about, a very important change.
A gender affirming.
That's procedure. It's a gender affirming surgery. That's totally different. This is not cosmetic surgery.
Right.
And this is very important to clarify here.
Right. So to keep going along so we don't miss out anything, why do you use plasma? Firstly, what is the plasma and how is it used and why did you
Why?
decide to start?
It's a
I
very
understand
good, it's a good question. Yes.
in the team you're the only one, right?
That's it. That's it. I'm the only one, and the only one using plasma for in all these procedures. We do not use it for a forehead or a jaw surgery or an sample. It's well, we use it as well. The plasma when we talk about simultaneous hair transplant or hair transplant as well, they use it a little bit. But specifically talking about rhinoplasty, plasma, I'm a big believer that it helps a lot, basically, because when we use the platelet-rich fibrin, that's the plasma. Okay, so it helps talking about restoration and regeneration of the tissues. It decreases any kind of potential complications such as an infection. There is less bleeding as well, since it acts as a kind of biological glue that helps for the readaptation of the skin to the new framework we have already achieved with the rhinoplasty. So it helps a lot. There are several studies basically confirming that this kind of plasma or platelet-rich fibrin is very useful. But talking about more oral or dental surgery, there are just few articles talking about that and the use in rhinoplasty. And that's my next homework, because I have to work. I'm right now doing or writing a scientific paper. I'm also including the use of the plasmas in the protocol for feminization rhinoplasty. But as I told you before, and I hope we can publish this maybe this coming year. I don't know.
Fantastic. So, Dr. Biginga, could you tell us what is the biggest challenge as a rhinoplasty surgeon and what are some of the risks that you have to prevent? And I'm going to get my chart.
The biggest challenge, everything. I would say the long term. Yeah, basically consistency and predictability. That's the biggest challenge. So I always like to explain to all my patients that are undergoing a rhinoplasty or a feminization rhinoplasty in this case, that the result is not about how beautiful you're gonna look for the first year. That nose has to be beautiful and functional, which is very important for the rest of your life. So it means the techniques we have to use should be very powerful, very consistent, and provide these good long-term results. Okay, that's the main challenge, not only for me, but for all rhinoplasty surgeons all over the world, that's for sure. Talking and going back again to the risks, we have to avoid these kind of complications are always related with the technique itself. Basically, as I told you, we have to provide a good long-term result, which means we have to avoid any kind of collapse, functional issue, functional problems, deviations, and that's all because of the structure we have worked or we have created below the skin. So these procedures have to be very consistent. Basically, it's very consistent. So the main problem is always the long term. Okay, so it's very frustrating because sometimes it's true that the patient looks quite good, the nose looks very good for the first year, maybe 2 years, but sometimes it's true that 3, 4, 5 years later, some issues may occur. Basically, when we talk about the function, and that's one of the the most important parts to be treated. And when we talk about feminization rhinoplasty, it's not only about making that nose beautiful. It also has to have a good function. So it's that's the major or the bigger challenge we have when we talk about feminization rhinoplasty, because basically we are changing totally a structure which is usually quite, let's say, big, and we have to make it smaller without losing that function, and that's the main challenge here.
Absolutely. So talking about complications, how do you go about managing some of the most common problems, such as swelling, bruising, and other symptoms and long-term problems like you mentioned? We do have a video about this actually that can be found on our blog, but why don't you tell us a little bit?
Okay, we should make a difference between what is called complications or medical complications, and also we have to talk about side effects of every surgery, okay? I like to include as in the side effect part, the swellings and bruises and maybe some, some kind of nasal congestion as well. That's common. That's something that basically in 99% of occasions it occurs. It's a side effect of a surgery, of an aggression, as a surgery is actually. Okay, so this type of swelling, the big swelling, these bruises will go away quite quick or quite soon, let's say 2 or 3 weeks time. Day after day and week after week, you are going to improve that as well, the breathing. But on the other hand, we may find, we may talk about, let's say, more medical complications. We are talking basically about infection or bleeding or hematoma formation, like in the other procedures, basically. It's true that these kind of complications are extremely rare and very, very rare, but may happen, of course. In most of cases, those complications can be very easily solved with more new antibiotic treatment or drainage, whatever. But it's true that sometimes we have to go for some kind of revision or some kind of small retouch just to obtain the result we were looking for, actually.
And can you tell us what the rhinoplasties have the highest redoing number? Can you tell us a little bit about that?
Yeah, well, it's true that when we talk about a rhinoplasty, if you ask to every rhinoplasty surgeon in the world, okay, it's very common that they say, okay, my revision rate is something about in between 10%, 12%, up to 15%, and that's accepted as an average revision rate. It's pretty high, actually, because rhinoplasty is not forgiven. It's one of the most, or from my side, I guess, it's the most complicated procedure or the most challenging procedure when we talk about facial plastic surgery. And satisfaction rate, for instance, in other surgeries like breast augmentation is higher than 90%. In our experience, forehead surgeries, satisfaction rate is extremely high. Is the highest one is more than 90-something%. And we talk about rhinoplasty, the revision rate is always a bit higher. Thank God, in our experience, in my hands, our rate of reintervention or retouch or revision rate is quite low. Is up to 4%, as long as I remember. So it's quite low, but of course it's there. Every year we operate almost or up to 200 rhinoplasties. So it means if that percentage is about 4%, so it means every year I have to do some kind of reintervention or retouch in 6, 7, 8 patients, which is quite low, but it exists, of course. If a surgeon tells you, okay, I have 0, as I like to say, run away from that consultation because he's a liar or he has no experience. It's very important to clarify that as well.
Absolutely. So, on this topic, one of the ways of helping patients in the orientation process is by managing goals and expectations so they're within realistic parameters. How do you go about doing that?
Well, if it's one of the biggest challenges we have when we talk about the face, not only the nose, but the whole face. Of course, it's extremely important. It's crucial to have to keep the feet on the ground. Let's say we have to keep the feet on the ground. Of course, dialogue, a good communication between the patient and the surgeon is key here. It's crucial. Okay, of course, me as a surgeon, I have the duty to understand, to communicate properly the degree of limitations we have when we talk about a rhinoplasty, okay? So the patient has to understand as well, and that's my duty, as I told you, to understand what are the anatomical limitations. There are several anatomical limitations, like in the rest of the procedures, for instance, the forehead and jawline surgery. We always have to follow anatomical landmarks, and we cannot go beyond those landmarks, otherwise we can have, or we can be in problem, okay? We can be in trouble as well. It's to avoid these kind of complications or to avoid undesired results, we have to keep, as I said, the feet on the ground and to understand those limitations. It's very well known that the major limitation, when we talk about the result in rhinoplasty, is the skin, the type of skin the patient has. The thicker the skin is, the less defined or the less refined the final result. And on the contrary, for instance, a skin type like mine, I have a very pale and thin skin. It's very elastic, which is good, but on the other hand, any kind of irregularity may become even visible, not only palpable, but also visible. Like in my case, my nose is broken a couple of times, and I have some kind of irregularities on my bridge. Anyway.
Some of that boxing, eh?
Well, that's a part. As I told you, I'm a bit freaky, but basically in many dimensions, in many ways.
But yes, what you're talking about now is extremely important.
It is. So
we're talking about
realistic goals and respecting anatomy. And of course, the facial features. I mean, when we talk about rhinoplasty, or let's say feminization in general, I like to say always, this is not about removing your nose or your face and placing a Barbie doll's nose. It's not like that, okay? We have to keep your core identity. That goes first. Well, first safety, then core identity, and then goes the rest. So it's all about being you. It's simple, being you. So you can still recognize yourself in a mirror, your family, your friends, your partners. So as I said, this is not about removing your face and placing a different face. It's the real you without the effect of testosterone, and as well including the same work done in the nose, in the rhinoplasty.
So talking about expectations, before we started the live, we were talking about perfectionism.
Yeah.
And so I assume that's a big part of what's discussed when you're managing expectations of patients, that we're not working with stone. In the case of the rhinoplasty,
it's flesh. Yeah, human flesh.
Okay, so can you tell us how a cosmetic or aesthetic rhinoplasty is different from a feminizing rhinoplasty, and why the nose is important in facial gender identity?
Okay. So talking about answering the first question, when we talk about a regular or the standard cosmetic rhinoplasty, basically in a cis male or female, it means the main goal is that we have to go from a not so beautiful, let's call it, not so beautiful nose, and we have to transform it into a more beautiful nose. This is quite complex, actually. But when we talk about feminization, rhinoplasty, it means we have to go from a male nose or a male nose aspect, okay? It's not about making a beautiful male nose. It has a double layer, another layer of complexity. So it has to look first feminine, and from feminine as well, beautiful, because that's always something that we are looking for, not only as a surgeon, but mainly the patient. The patient doesn't want just a feminine nose. She wants a beautiful feminine nose. So it adds another layer of complexity, I like to say, okay? Basically, a masculine nose is always a bit wider, larger, and the skin uses to be a bit thicker as well. So we have to deal with this extra complexity as well. So that's basically about the major challenge, the main challenge here when we talk about feminization rhinoplasty. The big difference when we talk about the rest of the cosmetic rhinoplasties. Also, we have to keep in mind that we have to deal as well with the other features. Everything has to be in proportion, harmonized. Basically, I'm talking about the forehead, and I'm talking as well about the upper lip. So that's one of the main reasons in most of cases we have to combine, or we combine it with the forehead reconstruction surgery. And in many cases, basically in patients that are over 35 or 40-year-olds, we have to combine it as well with an upper lip lift.
And we don't have time to get into that more today, but it would be very interesting to talk more about the ins and outs and finer details of combining the rhinoplasty with the lip lift and what that means, and with, of course, the frontal bossing, the forehead.
That would be great. So yeah, you can go for it whenever you want. That's it.
So going back to the rhinoplasty and feminization, I've heard you talking about different sort of results, right? Aquiline or gently sloping. Can you tell us what your philosophy is in regards to natural feminine results?
That's it. Very good question. Basically, as I like to say in many cases, the patient is always the VIP. I mean, so it means we also have to listen and we have to follow the taste of the patient. It's true that, most of my patients, or most of the patients that are coming here to facial team to do the surgery with us, when we talk about the rhinoplasty, most of cases, it's true that they like to have this kind of little extra touch of femininity, which means they like to go for the slight curve in the profile or making a small break in between the tip of the nose and the bridge. Let's say 80% of my patients ask for that. But as I like to say, when we talk about a feminine nose or feminine, beautiful nose, you can go for both profiles. Let's say you can go for a totally straight one, or with this tiny little curve, as I said before, in the profile. Both are beautiful, both are extremely feminine. It's just up to your taste, or up to the patient's taste, let's say. And of course, again, when we do the pre-op consultation, we always have to take some measurements, also looking at the CT scan, putting the scan also in the software, working on the computer. So that's part of my homework. And it has to be always under proportion. And that's one of the main reasons I'm always the last guy doing the surgery, because first my colleagues have to work in the other features, basically the forehead, the jawline. And then once they have finished, I come into the theater and I take new measurements, and everything has to be in balance. Everything has to be in proportion. So that's the main reason I'm always the last guy doing this surgery.
But today you're not.
Today, basically because now we have, my colleagues are doing now a forehead surgery, and when they finish the forehead, it's my turn. But the other patient, which is a bit longer, I'll be doing the surgery, I guess, in 5-6 hours maybe. So plenty of time for this first round. Right. Then take some lunch and go ahead.
That's good. We want our surgeons to be rested.
And that's my life. And that's my life. This is my week. I'm looking forward for this for Friday afternoon.
Just like everybody else.
That's it.
But this is good. We like you. Put you to work, feed you, put you to work again.
That's it. That's it.
So I'm glad that you brought up the bit about doing your homework and listening to the patient, because I think it's really important to emphasize that the expectations and coming to the ideal surgical plan is about the conversation and understanding what are the tastes, the preferences of the patient, and putting that within anatomical and safe parameters.
And that's one of the main reasons in the pre-op consultation. I like to ask my patients, okay, please tell me, using your own words, what are the 3 main concerns you have about your current nose, or the things you would like to accomplish with a rhinoplasty. So that's the first step, because I need to understand what's going on, let's say.
Exactly. So can you tell us, talking about their questions, what are some of the most frequently asked questions that patients ask, flip that around. What are some of the questions you think that patients should ask in their consultations?
When a patient comes just for the consultation, I always like to say, you have to do your homework. You have to do your research. And this is very important. I try to be very honest. I try to be a nice guy, and then I try to be a good surgeon, but first a nice guy and honest guy. So it means I like to say, please feel free to ask to other opinions, other doctors, but please as well be aware that the doctor you're looking for or you are asking is experienced and he's skilled about rhinoplasty or feminization rhinoplasty in this case, because as I said before, rhinoplasty is a non-challenge, it's a non-forgiving procedure. And so the patient has to ask the doctor, the surgeon, okay, how many rhinos do you perform, a month or a year or every week, okay? So it means the surgeon has to be extremely used to this procedure. So it's not about, okay, I do it from time to time, or I do one or two rhinoplasties a month. I guess from my side, from my point of view, okay, that's not the ideal candidate, okay? So everything has to match, let's say. So if the patient has doubts, not sure, I don't trust this guy, I think this place is weird. So then, as I said, stop, do nothing. Don't go for the rhinoplasty, don't go for the procedure. It doesn't matter if it's nose or forehead, chin, never mind. Everything has to match. So it means you have to go for the surgery, plenty of positive energy. You must trust the surgeon, okay? You must know the surgeons are going to be always there for you, for bad and for good, but they are going to be always there. Because if there is a complication, or there is a problem, whatever, you must know that this guy, the surgeon, will be always there to help you. Okay, that's extremely important. And that's part of the homework the patient has to do, or the research the patient has to do. So feel free to ask, to go to different places, ask different options, different opinions. And if you feel confident enough and you feel sure about what you're doing, then go there and go and do it with that surgeon, with that group, that hospital, whatever. But if there is doubts or there is something that doesn't fit so well, then stop. It's better to stop. That's at least my point of view.
Thank you so much for your...
It's very personal. This is very personal, I know.
Thank you.
I think it's very, I guess it's quite honest.
And just to let you know, in the chat, we've got some comments of people that are thanking us for this very informative live. And I want to thank you, Dr. Berlinga, so much for your honesty, your honesty, your frankness, your directness. It's so important when we're talking about surgery, and for our patients, it's life-saving. So it's even more important. Unfortunately, we still do hear of patients who, follow this advice that you're saying. Now go with who you really feel. You have to trust this person. They trust these surgeons, but when something happens, they find out that it's not who they thought they were. So,
well, at least with us, as I like to say, after the surgery, and this is one part of my speech when I do the post-op consultation or the final consultation after the surgery, so before the patient leave or go home, go back home and take a flight or whatever, as I like to say, this is not a goodbye, it's always a see you later, because we are going to be always in touch with you, and you can be always in touch with us. I do understand, of course, and most of our patients are from abroad. And I do understand as well that fear, that stress, okay, you're going to a different country to undergo a major surgery, actually. So you must be sure about what you're doing. You must trust the team, okay? And that's the reason I say, okay, we are going to be always there, okay? It's always very easy to be in touch with us.
Absolutely. So, and our final point that we were going to discuss is the post-op period. Last but not least, it's
very tricky.
A very big concern. And the link that I've put to our blog has a video that Dr. Berlinga did on the post-operative period with Sonia, and it's quite good. So can you just tell us what can patients expect and how they have to care for themselves, or do they have to care for themselves?
what are you going to expect? It's a roller coaster of emotions. That's it. So, the nose gets pretty swollen in many cases, not always, but in many cases gets pretty swollen. Basically, as well, if you combine it with other procedures or basically the forehead, just because of gravity, the swelling, which is liquid, it's water, actually, it goes down and basically starts to accumulate around here. So it may be quite frustrating at the very beginning, okay? Basically, when in the front view, okay, when you're facing a person or when you look at yourself in a mirror, you say, oh, fuck, it's like, you look quite swollen, everything looks quite undefined. Thank God, this big change, this big swelling will go away, let's say, quite quick or quite soon. And let's say in week after week, you are going to improve a lot. But also we have to keep in mind that this swelling will go away quite quick, but not in a very symmetrical way. So what does it mean? Sometimes it's true that one side goes down quicker than the other side, and it may look like it's slightly crooked, or the tip goes towards one side. 2 weeks later, it looks like it goes towards the other side, and you may think, okay, what the hell is going on here? What's happening? Basically, it's also very common, very typical. Okay, one nostril looks different or asymmetrical or bigger than the other one. It's just pure swelling. We cannot evaluate that. Of course, you are going to look at yourself in a mirror several times a day after day, and week after week. And of course, you will be very, not obsessed, but you're going to be very focused on that. Okay, basically about the nose, because the other features, they do not respond so dramatically, let's say, because the nose is basically soft tissue and it gets quite swollen, sometimes the tip. I'm talking basically about the tip. So at the very beginning, the first weeks, these changes will occur very quick and very, in a kind of exaggerated way, let's say. And that can make the patient look a bit, under anxiety. Let's say it's a quite stressful period. Let's say
it is. It's a process,
and that's why most of cases it's true that we have to say that the final result will come, but in a long term. We are talking about 1 year time. And actually, to be honest, it's always longer than 1 year. Basically, it may be in the type of skin I have. If I do a surgery or a rhinoplasty in my case, maybe I see the final result in 1 year time or 15 months time, okay? But when we talk about a thicker skin patient, maybe the final result will come in 2 years time. And this is very often, or when we talk about secondary or tertiary rhinoplasties, it's always even a bit longer. It doesn't mean you're going to be swollen for that whole year. I'm talking about the first weeks, but to see the final detail, the final readaptation of the skin to the new framework, that takes a long time. So in short, this is a very stressful, very emotional period, okay? You must understand at the beginning, this is not your current phase, it's a swollen phase. This is not you, not yet, all right? Basically, if you combine it with the other procedures, as I said, rhinoplasties, and also in combination with the chin surgery are the procedures that need longer to heal or to see the final result. But as I told you, it doesn't mean you're gonna be extremely swollen for 1 year. It's not like that. The big swelling will go away quite quick. In most of cases, let's say in 2-3 weeks time, most of people won't look at you twice or turn the head around. No, it's not like that. But of course, you're swollen. I know it, but nobody else, let's say. That's more or less average.
Okay, I have a question that maybe is a little tricky for you, the last one.
Go ahead.
So
I guess I have to go.
So I'm putting the hard questions to the surgeons on behalf of all our patients. Like I sometimes say, I've hijacked this platform for the good of all of our viewers. So you mentioned earlier that you have to do redoing cases.
Yeah.
And so a patient, for whatever reason, despite all the planning and precision and safety that you put into this, for some reason, something hasn't healed to right, and you have agreed that you can do better. So redoing cases are more difficult because you're working on tissue, which is already has scar tissue in it. So can you tell us a little bit about how you approach the redoing cases?
Okay, it's still quite frustrating to me because I have to admit I get very obsessed about my job. It's my passion, actually. It's not only a job; it's my passion, and it's very frustrating when I have a non-satisfied patient or if I have a problem. That I'm always thinking about. Okay, how could I avoid that? Did I do something wrong here? And that's one of the main reasons. Just 5 minutes after every surgery, I go to my computer and I have an Excel table. I write down everything, the technique I have done, how many grafts, the type of grafts I have used, how long did it take me to do the whole surgery, the type of anesthesia I have used. Everything is in detail. Everything. Also the type of sutures I use, everything in detail. And this is extremely helpful, because sometimes, imagine if I have a non-satisfied patient, or I feel here I have a residual hump yet, then I go back to my Excel table, let's say, I said, okay, I look for what I did there. Sometimes as well, I play just looking at the before and 1 week after the surgery. Okay, what type of procedure should I do? I mean, it's like I'm always challenging myself. That's what I try to say. So it's quite frustrating. And of course, it always happens. I have to admit it. I'm honest with that. And I always try to do my best. The thing is, it's true that when we have to go for a retouch or a revision rhinoplasty done by myself, I mean, my own revision, it's always, again, quite challenging. It's even a bit harder, let's say, for two main reasons. The first one is that, of course, I have to deal with scar tissue and a totally different anatomy. It's not a primary rhinoplasty anymore. It's not virgin. It has been violated tissue, let's say, and I have to deal with that scar tissue, which makes everything much more unpredictable, even more unpredictable and tougher for me. But that's my duty. That's my thing. It's not patients. And second, when we have to do a rhinoplasty, the modern technique is about making what is called structured rhinoplasty. So it means in most of cases, or at least in almost 100% of my cases, I deal as well with the septal cartilage. So it means I always remove part of that septal cartilage. I remove the deviated portion, okay? But I use that septal cartilage to obtain some grafts to reinforce and to restructure and to reshape the new nose I want to achieve. But if I have to do a revision, such a case, then I don't have enough septal cartilage because I've removed it before. So it means it's true that in most of cases, I need to go to a different part of the body to obtain some extra cartilage. Basically, I'm talking about the back of the ear, some cartilage here, or sometimes the rib. And of course, from my side, it's always quite difficult to make the patient understand I have to go to take a small piece of rib cartilage or the ear cartilage just to rebuild again the nose. So to be honest, that's quite frustrating for me and basically, of course, for the patient. That's true. As I said, in my experience, I'm talking about maybe 6 cases a year, since I'm doing quite a big volume of rhinoplasties. But I have to be honest, I mean, they are always there. And honestly, I always try to do my best. I swear, I always do my best. And this is not to be nice.
We don't doubt that.
Conversation, but
we don't doubt that.
It's very frustrating because it's true that when I have these kind of cases, I get very, I don't get down or depressed, but it's like, I think a lot about that. That's what I try to say. So rhinoplasty is an extremely beautiful procedure. I love it. But on the other hand, it's so challenging that you must be really sure, a surgeon, that you want to dedicate lifetime to this procedure, because sometimes it's like the patient. This is kind of roller coaster, you know. So, well, as I said, you know, I always try to do my best, and I'm very honest. I have to recognize my own failures, and I keep on improving. I keep on learning. That's extremely important. Okay, I try to be always updated. I always try to be always in touch with other good rhinoplasty surgeons all over the world. I try to be, you know, we have also our own communities here in WhatsApp or Telegram groups. You know, we sometimes we share our experiences and our doubts, fears, problems. Actually, you know, we go to congresses and we read and we write scientific papers about that. That's the only way to, you know, to grow up.
Absolutely. And when it comes down to it, like we said earlier, despite all the science and technology behind surgery, rhinoplasty or any procedure
surgery,
is not an exact
cross finger sometimes, because even if you do a perfect job, you're so proud. Even the theater, everything was really perfect. You say, wow, it was a beautiful nose. Then it depends as well on the healing process. Okay, and so that's all about, okay, and we cannot predict that. Sometimes because of the healing process or the scarring process, we may find some degree of asymmetry or small deviations, and that's the reason to say, oh, fuck, why? Because this is something we cannot even predict and we cannot avoid. So it's not the patient's fault, it's not the surgeon's fault. Well, actually, yeah, I did the surgery, maybe it's my fault, I don't know. I did my best, everything was really perfect, you know, but then there is this kind of little asymmetries that sometimes it bothers quite a lot of the patient. It's like, that's the reason, it's frustrating. That's the word. It's very frustrating, because it also depends on doing like this and say, okay, go good. so well, please. And sometimes not like that. I say, oh, why? Because this is not working on the bone. And that's the main difference, you know, with, like, for example, the forehead surgery or jawline surgery. In those surgeries, we deal just with the bone, and then we check everything and say, okay, that's all perfect. We cannot go even further, you know. But when we deal with the rhinoplasty, we are talking about soft tissue surgery. So everything becomes much more unpredictable, because soft tissue surgery is strongly affected by this, you know,
the healing process.
The healing process, this tension, and then it's like, yeah, as I said, frustrating.
Yeah, I think you've made the point perfectly, that despite it happens to all surgeons, really, and it takes a special person like you, Dr. Berlinga, to put your neck on the line, really, when it comes to rhinoplasties. And you know, surgery is not, like I just said, it's not always an exact science, because the tissues, in the case of the rhinoplasty, are subject to the forces of healing. Sorry, I've got a fly here. So to close a little bit here, Dr. Berlinga, thank you for being so transparent.
Well, thank you for allowing me to share all my, well, what I have in my mind and my heart as well, you know. Because
yes, you've been very open here. Thank you so much.
It's therapeutic for me.
I wish that there had been some more questions, but I think the time of the day, most people are either working or sleeping around the world. So if anybody has questions, please contact us. Consultations are free, so just go to our website.
It'll be my pleasure. Really, thank you so much for being there and watching and hearing this video and this program, because I have enjoyed a lot.
And
it was kind of examination at the beginning, you know, but then I've enjoyed a lot.
I just want to thank Ayla and Julie and the other Alessandra and Ruth, who have all made comments here in our chat and have been watching. We really appreciate it. 58 reproductions of the video already. Yeah, people have been watching for a decent amount of time. We've been going for an hour. And so I just want to say thank you to everybody. Please, if you're here, please give us a hand in the chat. for Dr. Berlinga too, for being so frank and honest and open and sincere about his work. So do you have any suggestions, Dr. Berlinga, about places to visit on the Costa del Sol when people come?
Go to restaurants. I'm a big eater. I love it. Okay, we are all known here just because of the weather. Bullshit. Go to restaurants, eat our gastronomy. It's perfect. It's wonderful. So go for it. And also red wine, please. Red wine, always. That's a doctor's recommendation, okay?
Doctor's orders. Red wine. Yes, the Tinto here is very nice. Great. So thanks, everybody. Thank you again, Dr. Berlinga. Please come back later, everybody, for another live stream this afternoon for our monthly episode with DM Maynard to meet with Corinne, who is of the Trans Equity Project in Pennsylvania, and she'll be meeting with us today. That is a live stream, monthly live stream aimed at parents, partners, and educators. So the other side of the coin, very important people who support our patients when they are transitioning. Stay tuned. Check the blog out again, please. On the blog, we have a summary of what we talked about today and 3 different video tutorials. I've shared a link in our chat of our PeerFace group to sign up for our newsletter. Like, follow, do the dance, give us kisses, please. So, as I always close, remember, your healthcare and happiness matter. Thanks again. Bye-bye.